So here we go. Now, talking about the Bacillus anthracis. Bacillus anthracis is a gram-positive spore-forming rod that produces anthrax toxins. Anthrax toxins, that is exotoxins consisting of protective antigen, lethal factors, inhibits MAP kinase, macrophage apoptosis, and edema factors acts as adenylyl cyclase, that is increased CAMP, that is cyclic AMP, upsetting homeostasis. Edema necrosis has polypeptide capsules, that is poly D glutamate. Colonies shows a halo of projections, sometimes called Medusa head appearance. Now, Bacillus anthracis is of two types, that is cutaneous anthrax and pulmonary anthrax. So, talking about cutaneous anthrax, it is a painless papule surrounded by vesicles, ulcers with black scar. That is painless necrotic, uncommonly progress to bacteremia and death. Similarly, for pulmonary anthrax, inhalation is of spores, most commonly from contaminated animals and animals product through all although also a potential bioweapons. Flu-like symptoms that rapidly progress to fever, pulmonary hemorrhage, mediastinal that is chest X-ray may show widened mediastinum and shock, also called Sorter's disease. Now, prophylaxis with ciprofloxacin or doxycycline when exposed with both cutaneous and pulmonary anthrax may be complicated by hemorrhagic meningitis. Now, moving to the next page and talking about Bacillus cereus, gram positive rod causes food poisoning. Spore survive cooking rice, reheated reheated rice syndrome. Now, keeping rice warm results germination of spores and enterotoxins formations. Now, endemic types causes nausea and vomitings within 1 to 5 hours. Cause of cerulide of preformed toxins. Now, diarrhea types cause watery, non-bloody diarrhea and GI pain within 8 to 18 hours. Now, management's supportive care, that is antibiotics are ineffective against toxins. Now, Clostridium difficile, talking about clostridioids, difficile products toxins A and B which damage enterocytes. Both toxins leads to watery diarrhea, pseudomembranous colitis, often secondary to antibiotics use, especially clindamycin, ampicillin, cephalosporin, fluoroquinolones associated with PPIs, that is proton pump inhibitors. Now, fulminant infections, that is toxic megalocolon ileus shock. Now, to remember, that is difficile causes diarrhea, that is Clostridium difficile causes diarrhea, diagnosed by PCR or antigen detections of one or both toxins in stool. Now, treatments: oral vancomycins or fidaxomicin, or recurrent cases consider repeating prior regimen or facial microbiota transplant. Now talking about Clostridia that is to gram-positive spore-forming obligate anaerobe rods. Tetanus toxins and botulinum toxins are proteases that cleaves snare proteins involving in neurotransmission. Now talking about Clostridium titani, that is titani, pathogens is non-invasive and remains localized to wound site, produces tetanospasmin and exotoxins causing tetanus. The tetanospasmin spreads by retrograde axonal transport to CNS and blocks release of GABA and glycine from Ransom cells of spinal cord. Now cause a plastic paralysis, trismus that is lockjaw and rhizus sardonicus that is raised eyebrow and open grin. Now opisthotonus that is spasm of spinal extensor. Now to remember, tetanus is tetanic paralysis. Now prevents with tetanus vaccines treated with antitoxins plus that is the vaccine boosters, antibiotics, diazepam for muscle spasms and wound debridement. Now talking about Clostridium botulinum produces a heat-labile toxins that inhibits acetylcholine release from neuromuscular junctions, causing botulism. In babies, ingestion of spores in honey leads to disease that is floppy baby syndromes. In adults, disease is caused by ingestion of preformed toxins, examples in canned food. Symptoms of botulinums that is 5D that is diplopia, dysarthria, dysphagia, dyspnea, descending flaccid paralysis, does not present with sensory deficit. Now botulinum is from a bad bottles of food that is juice and honey. So it can be easy to remember like this. Now treatment that is human botulinum immunoglobulins, local botulinum toxins A that is Botox injections used to treat focal dystonia, then hydrosis, muscle spasm and cosmetic reductions of facial weakness. So this is very famous that is Botox injections are taken up by different peoples. Now talking about Clostridium perfringens produces alpha toxins that is lecithinase or phospholipase that can cause myonecrosis that is gas gangrene, presents as soft tissue crepitus and homeolysis. If heavy spore contaminated food is cooked but left standing too long, that is less than 16 degrees Celsius, spore germinate. Now vegetative bacteria, heat labile enterotoxins, late onsets that is 10 to 12 hours, food poisoning symptoms, resolutions in 24 hours. Perfringens perforates a gangrenous leg. Similarly, spontaneous gas gangrene that is through hematogenous seedings associated with chronic malignancy is most commonly caused by Clostridium septicum.